Today we will discuss about prostate cancer. So what is prostate cancer? Abnormal malignant cell growth in the prostate gland in the male reproductive system. So prostate gland is one of the male reproductive part of male reproductive system, one in number. So you can see in the picture here, this is the normal prostate gland here, below the urinary bladder and behind the urethra. See here you can see abnormal cell growth means a cancer prostate. So how it is? So generally the tumor grow very slowly and it remain confined in the gland itself for many years. It takes time to spread to become a metastasis. Okay. So because of that, the client will not come to know only because it will not give any signs and symptoms. Okay, incident as the age advance, it is more, the man is more prone for the prostate cancer. Okay, it is the most common malignancy in American men and the second leading cause of death. 75% of the male affected at their 75 years of age and 80 at their 80 years of age. So it indicates as the age advance, the prostate cancer ratio also, incident also more. So you can see in the picture here, see how this is a normal prostate gland, see how it is here, this malignant tumor. Malignant means it's a spreading, it's not a benign, it's always malignant, okay, prostate cancer. So initially if it is come to know, if it is a removed the cancer cell, yes, the person can be like lead a normal life and all that. Okay, what may be the causes for prostate cancer? For any cancer, exact causes is unknown. The contributing factors are, one is the age, common after the age of 50 years. That is because of the hormone itself. Genetic factor, family history, faulty BRCA2 gene. It's a kind of a gene, okay, linked to aggressive form of prostate cancer. Those who are born with this kind of gene, they are more prone. Diet, lack of vegetables and having only red meat, more prone for the prostate cancer. And a vitamin, there's a lacking vitamin D. Diet high in a red meat may raise a person's chance of developing prostate cancer. So have more and more green leafy vegetable. What are the other causes? Obesity, smoking, kind of habits like taking drugs, exposed to Agent Orange. It is a kind of a like a chemical agent, okay, strong chemical agent is not good, especially those who are working in a factory, on an army field, in a many where it can be. When the client is exposed for a long time, there is more chance. Medication, daily use of anti-inflammatory for small things without consulting the doctor, like a self-medication, it is not good. Testosterone is a male hormone produced by the testicle, so directly stimulate the growth of both normal prostate tissue and a prostate cancer cell. So the testosterone is a very important, needed for the prostate tissue growth, and that male genital organ it keeps in a healthy condition. That same testosterone leads to the prostate cancer cell also, means responsible for the prostate cancer. Sexual transmitted disease, the person is exposed continuously for the sexually transmitted disease. Enzyme PRSS3 linked to aggressive prostate cancer. It's a kind of a enzyme, okay, even that is also linked to aggressive prostate cancer. Okay, what are the signs and symptoms? So the cancer may enlarge and pressure. See, when it is a small, it will not give any signs and symptoms. As the tumor size enlarge, it start to compress the neighboring structure, especially upper part like a urinary bladder and a urethra. So same like a BPH, what symptoms you have seen, same symptoms it leads to here. Like urination become more difficult in urination, urgency, frequency, burning micturition, like a blood in the urine. Enlarge urinary bladder because the urine cannot flow properly, and waking every night, every often running for the toilet to pass the urine, and inability to pass the urine completely. In a later stage, symptoms of metastasis means already the tumor size is big and it has come out from the prostate gland, spread to the other parts of the body organ. Then the client will become fatigue, malaise, weight loss. Day by day, the client become weak. along with the other symptoms, urinary related symptoms. Okay, prostate cancer usually metastasis first in a lower spine as well as a pelvic bone. So according to how it spread, it involved the body part. According to that, it gives rise the symptoms. When it is a lower spine and a pelvic bone means it causing a back pain and a pelvic pain. Later on, it spread to the liver and the lungs. As a liver means it leads to abdominal pain as well as a jaundice. When it is spread to the lungs means breathing difficult, coughing will be there, chest pain will be there. So what may be the diagnosis or a screening test? One is when the client approach the doctor and through the history collection, when doctor collect the history, the later he will, when he suspect, he will do the digital rectal examination. Means a 3 finger he will put into the anus and rotate and see. So he could feel, the doctor could feel a lump, irregularity or a hardness felt on the surface of the gland. Some kind of a hardness. Blood test, various blood tests are required. Okay, that is the first one is a PSA, prostate specific antigen. If the level is a increase means it indicates a prostate related disease or disorder or a prostate cancer. Ultrasound guided needle biopsy transrectally through the rectum, ultrasound guided through ultrasound they will see, and they will insert a needle and they will remove the biopsy and they will send for the histopathology to know whether it is a cancer and at what extent it is a spread, all that. Bone scanning, why scanning CT, MRI, to know the extent of the disease, whether it is in prostate gland itself or it has come out from the prostate gland, and what all the body organs are involved, to know that. Urine analysis, urine exam, micro, culture and sensitivity, various blood tests, kidney function test, blood electrolyte, liver function, blood coagulation test. So all these test will be done. Then IVP, intravenous pyelogram, means by giving contrast X-ray of the urinary bladder, urethra and kidney will be taken. IPSS, International Prostate Symptom Score Sheet, means they will ask with the client and according to that the doctor will put tick. How many symptoms are present in the client to know. Cystourethroskopy, visualization of the urinary bladder as well as a kidney, urinary urethra, in order to know how much it damaged the urinary bladder and how much it is the spread. Stages of prostate cancer is a very important. The stages is divided into 4. Stage 1 is the cancer cannot be felt on a digital rectal examination and there is no evidence that it has spread outside and it has not spread also, and there will not be any kind of symptoms. These are often found incidentally after surgery for an enlarged prostate, that is a BPH. Because it is not spread, it is confined to prostate itself and small in size. Stage 2, the tumor is a larger than a stage 1 and can be felt on a digital rectal exam when doctor do. There is no evidence that the cancer has spread outside the prostate. It is not spread outside the prostate, okay. Stage 3 is the cancer has invaded other tissue neighboring the prostate, means it already, you can see in the picture here. See, stage 3, already the cancer. Stage 1, see, it is inside the prostate gland itself. It has not come out. Second one also, it is inside the prostate gland, but size is bigger than stage 1st. Stage 3rd is it has already come out from the prostate gland. So, it's a danger stage because already it has come. It will start to spread everywhere all over the body. Then what is the stage 4? The cancer has spread to the lymph nodes and other organs. So you can see in the picture, it has come out through the blood circulation, entire organ, through the lymph node, everywhere. It is spreading one by one. Pelvic bone, then the later liver, then the lungs and entire organ. Okay, what may be the management or a treatment? Since it is a cancer, the immediate management is the client will be treated with a radiation therapy, chemotherapy, hormonal therapy, luteinizing hormone, releasing hormone agonist, okay, and cryotherapy, that is a freezing the tumor, okay, in a by freezing the tumor with that a kind of a liquid is poured through the syringe, poured over that cancer cell only in order to freeze and destroy the cancer. Okay, it's a new technique. And the client, if it is a very old or due to the client is suffering with a major health issues, cannot undergo surgery, means they will treat it with this only, radiation or chemotherapy, hormonal therapy. Okay, if the client is capable, he can undergo for surgery, means along with this the surgery also will be done. See, cryotherapy, you can go through, you can read this. They may ask for the 2 months. Then one more is there, that is a HIFU. That is also kind of a high intensity focused on a ultrasound based, ultrasound guided, okay, focused on a cancer cell to destroy. Okay, along with that chemotherapy, hormonal therapy, surgical management, that is a orchectomy, means either damaging or removal of one or both the testes, because the testosterone itself is leading the prostate cancer. For that reason, or radical prostatectomy and TURP, means complete removal of the prostate gland and some of the tissue around it. For metastasis, hormonal and chemotherapy. Metastasis means it is already spread to all the vital organs. So vital organ cannot going on remove it. Doctors will do the surgery, some extent they will remove the cancer cells, but a complete cancer cell cannot be removed. In such condition, the client will be treated before the surgery as well as after the surgery also with the chemotherapy as well as a hormonal therapy. What may be the nursing management as a nurse? Since it is a surgical case, pre as well as a post-operative management will be there. Pre as well as a post-operative assessment will be there. Assessment include history collection, physical examination, forming the nursing diagnosis, according to client symptoms, forming the diagnosis and carrying out, implementing and evaluating. Okay, even post-operative also, general management as a nurse, proper explanations should give for the client, emotional support to patient as well as the family members, and after the surgery, advising the client to take a medication properly and a follow-up at the right time with all the blood investigations. Thank you, student. Hope you understood. Okay, next other remaining disorder we'll deal in a next.